Hello, sir. ده أحاول بس أأمن ويا دكتور هيمنت. Hello, doctor. Hello, doctor. Yes, Dr. Vinod, I was just trying to call Dr. Heyman Sharma, and he's supposed to be here. And if you're free, you can also be join us, and we want a discussion about the Indian virus and all this COVID who attacked India. دكتور هيمن لسه محاضر. إبراهيم أصعدك للبث لما يجي دكتور هيمن. دكتور قتيبة إذا تسمعني بلكي تتصل بدكتور هيمن يبدو أنه عنده مشكلة لأنه ما بده يصعد على أونلاين. دقيقة خلينا each and everyone. Let's welcome Dr. Heyman Sharma from Pratiksha Hospital in Delhi. Hello, sir. Do you hear me? Again, try once again. Hello, doctor.
Hi, Ali.
Yeah, welcome to you, doctor. And we are, now the media in Iraq and everywhere, all the Arabs, they are separate a lot in the news about the Indian virus. So I would like to invite you for my host and all of my friends. Here's the Dr. Heyman Sharma. He's a senior surgeon in ortho in بروتكشا هوسبيتال. دكتور هيمن شرما اختصاص في مستشفى بروتكشا، راح يتحدث لنا عن الفيروس، وان شاء الله اي سؤال وجهه لي وانا احاول ان اساله او اوصل سؤالكم. Yes, doctor, please.
Yeah.
So the topic is about that they call it now Indian virus. So what did you agree with it, or it is the same COVID? And
see, there has been a mutation. So mutation, see, if in the human beings, in us, if the mutation has to take place, it takes years and years. Whereas in virus, it is much more quicker. And we have vaccines, okay? So vaccines have got a unique identification code. If we have the unique identification code, and all the mutant viruses have that unique identification code, then the vaccines should be effective against all the mutants. But we still don't know whether the mutant virus has that unique identification code or not. We don't know that.
Okay.
Because
so I
virus
just
keeps...
translate to this line. Can I?
Yeah.
الدكتور يقول طبيعة كل الفيروسات والأجسام هي عبارة عن كودات اللي صار، وممكن أن تشتغل نفس العمل، ممكن أن تحدث طفرات. فاللي صار هل هو هاي طفرة وراثية أم هو الفيروس نفسه؟ لحد الآن ما عندنا علم به. Yes, doctor, please continue.
So people are going with the fact that they are checking their saturations, which is good. But more important is the number of days from the symptoms. So what happens normally? So you start having a, say, cough or a cold. Then next day you start getting fever. And you think you may have a coronavirus. Then you go for the test. The test takes 3 to 4 days now. So by the time the test report comes, it is already day 4 or day 5. So if at day 5, two important things we should know is that we must start the patient on a steroid and a blood thinner, because these are the two very crucial things. So at day 5 and day 10, the effect of virus is gone, but our body is trying to respond to that. So there is a cytokinin storm. So to decrease that storm, there is a big role of steroid, and it has been now shown that it decreases the need for oxygen and ventilation if timely intervention is done at day 5.
So may I just take this headline? It's a good, I want to explain to them. الدكتور يقول بالعاده انه احنا شلون نعرف انه هل احنا مصابين او ما مصابين؟ يقول بسبب هسه كثره الحالات، فالفحص حتى تطلع النتيجه قام ياخذ 4 إلى 5 أيام، وهاي ال4 5 أيام الشخص ممكن جسمه يضعف. فاي شخص عنده يشعر بالاعراض اللي هي الحمى او الكحه او البلعوم او السخونه، يروح ياخذ لازم يعني حتى لا يسوي الفحص 5 أيام لما تطلع النتائج هوايه، ياخذ ننصح فيه هسه استرايد ومخففات دم، يعني بلاد ثينر. Okay, doctor. So this is the first two things.
Yeah.
Steroid and blood thinner.
So steroid and blood thinners, they are very, very useful. Now, all those patients who are in the hospital, there are many anecdotal studies. There are many studies, and a lot of doctors believe that giving them remdesivir is helping them. Okay, so we get different type of uh, information from different doctors who are daily treating it. But those who are admitted in the hospital and those who have got a moderate disease, like a CT score is showing its value is high. So in those cases, steroids, blood thinners, and remdesivir is helping. I'm telling this not from my experience, but I'm telling this from the experience of pulmonologists, doctors who are treating it every day, every night, these patients. And one thing is very clear, during this time, we should not be operating. That's very important, because there is a lack of oxygen to people who are having COVID. And so it's more important to provide it to them rather than doing surgeries and things like that. But people who are already, they are here from Iraq, they are very much in a hurry to get operated. And I'm telling them, please don't get that. Because if we are finding it difficult to get beds for people who are here, how are we going to arrange beds for those who have come from abroad?
Right.
So they should be staying indoors. Don't worry, you are here, you are indoor, you will be safe. But don't roam about then. Just stay in the hotel.
Okay. I'll just tell them about this point because it's so much important. الدكتور هيمن شو يقول احنا يعني المريض من يدخل المستشفى بدنا نعالجه بهاي الامور نفسيه، الاسترويد ومخففات الدم، بس النقطه الاهم بعد ما نتاكد منه بفحص السي تي سكان اللي هو المفراس، احنا نعطيه يعني نحتاج دائما الاكسجين، يعني الاكسجين هو اللاعب الاساسي بهذا الموضوع كله. يقول فاني هسه كمستشفيات الهند هو مو ما استقبل المرضى العراقيين، بس انا اقول الاولويه انه ما اسوي هسه عمليات لان اكو مريض ممكن يكون محتاج الاكسجين. فلذلك نقول لهم لا تطلعون، ابقوا بفنادقكم، لا ترومون هنا وهنا تفترون، يعني لانه تعرضوا نفسكم الى خطر الاصابه، واحنا مو متعاجزين من ان نقوم لكم بعمليات لان انتم بعد سافرتم ووصلتم، لكن بس خلي تعدي هاي الازمه. اوكي continue please.
The second thing is, you see, anything which goes up has to come down also. So we are hoping if this is a natural way, then
okay.
Tornado is at a very high speed. It doesn't go to that long distance. So that's why if things are going up very fast, it should fall down also very fast.
الدكتور يقول هي معادلة، يعني كل شيء يقفز بسرعة منحني راح ينزل بسرعة، فاحنا نتوقع هذا الأعداد الإصابات الهائلة راح تنزل بنفس السرعة اللي صعدت بها مثل الإعصار. Yes.
Yeah. So the best advice if we can give to anyone is that they should be staying indoors and they should not come out. People, those who think they will not get it, that's wrong. So the best way is just stay at home and avoid alcohol, smoking. These are the two things to avoid.
Okay, sorry sir, can you come again? What is the second things you say about?
I said you should stay indoors and keep away from vices like drinking, smoking. Definitely that's very bad.
Okay.
And a lot of people who come from Iraq.
تبقون ببيوتكم، تبتعدون عن التدخين لأنه مسبب رئيسي التدخين. Yes sir.
So if there's any particular question you would want to ask.
I will ask. الدكتور يقول أي واحد عنده سؤال ممكن يكتب لنا إياه بالتعليقات حتى يجاوبكم عليه. I was just try to pick any question. If anyone have a question, please write it down. So Dr. Heyment, he will, of course, he will answer you, because we have received before lots of a question that whether this COVID is going to like going far away from India to Iraq,
they are worried that the patient can be carrier to that virus. And do you think that it can be transferred?
When we did not have it, we were worried that we are getting a UK strain. Now UK is worried that they are having an Indian strain. So
Right.
this is something, because of the globalization, people traveling so much, this is something really very difficult to control and prevent.
Yeah.
People have called it as an Indian strain. We don't know
Yes.
exactly. All we know is, yes, there is a mutation that has happened. But one thing is very sure, those who have got 2 vaccines, we have seen that those patients are not having a very severe illness. Their need for hospitalization is less. Those people who have had 2 vaccines, very few people, I would say in very small percentage, are getting a disease which is very bad.
So do you suggest people to take vaccine, because so many people are refusing to take?
Definitely, you should take vaccine no matter whichever company it is. You must take vaccine.
الدكتور يقول شوف سألته انه هل ممكن ان ينتقل لدول اخرى؟ يقول سابقا كنا احنا نقول الفيروس البريطاني راح يجينا، كنا نتخوف من عنده. هم نفس الشيء هسه العولمه هي الان بسبب التنقل، والدول الاخرى ايضا تقول انه هذا الفيروس هندي او هذا هو ممكن يكون نتيجه طفره. يقول بعيدا عن هذه المسميات، المفروض اللي نشوفه يعني نسبه جدا ضئيله من الناس اللي اخذوا اللقاح هم انصابوا، والناس اللي اخذت اللقاح اي لقاح كانت نسبه حمايتهم من الفيروس كلش عاليه. يقول انصحكم ان تاخذوا اللقاح واي نوعيه كانت، لا تخافوا من عندها. Yes, doctor.
So somebody has just asked the question, are there any side effects of vaccine? Well, after vaccine, many people experience body aches and fever, but this is very temporary, maybe 24 to 48 hours. But the benefits are definitely more than these side effects.
طبيب يقول عادي، يعني اكو ناس تصير لها اعراض بعد اللقاح، هي اعراضها كلها مده 24 ساعه، لكن الفائده عظيمه. يعني الفائده هي اكثر من شغله الاعراض المؤقته اليوم واحد. شباب اي واحد عنده اسئله خليه يكتبها بالبث، لانه بالبث السابق هو كانت اكو اسئله. هسه الدكتور موجود حتى ناخذ الاسئله ويجاوبكم. يس دكتور.
So any particular question you want to ask? Yes, one message I want to give is that at this point of time, avoid traveling, avoid surgeries, because you hear it in the news. Yes, there is a problem of beds, oxygen and medications. So for all those people who are coming from Iraq, they should understand, if there is a problem of people who are living in this country, and if they cannot get the beds, the medicines and the oxygen, then the problem for them will be bigger. And those who have had surgeries should definitely stay inside the hotel and not go out, because if they develop fever or any symptom after the surgery, it is very difficult for us to control and diagnose, because each test is taking 3 to 4 days time before it comes.
Right. يقول اللي انصحه انه الان في الوقت الحالي ما انصح احد بالسفر، انصح الناس ان تبقى ببيوتها، لانه الوقت الحالي هو الاولويه للناس اللي سوت عمليه والناس اللي مصابه بالفيروس، هذا الاساسي نعالجه. اللي عنده سؤال خليه يكتب لنا اياه بالبث حتى ما نضطر ان نغلق البث، خلينا نستفاد من وجود دكتور هيمنت. اكتبوا لنا اسئله شباب، ما اعرف بس اذا استلم تحايا، ما اذا استلم اي سؤال. اذا احد عنده سؤال رجاء خليه يكتب لنا اياه بالبث جوا.
So you should not wait for the saturation to go down. You should count the number of days. So first day fever, so 5 days. So 5th day is very important. So by 4th, 5th day, your doctor, who's treating you, must consider blood thinners and steroids. And in those in patients who have got unfavorable CT scores, on the CT scan there is a picture, they should be started on steroids little bit early and blood thinners bit early. And in orthopedics, all the patients who come to me, most of them are patients who have hip or knee replacements. We anyway give them blood thinner medications for 15 days for knee replacement and 35 days for hip replacements. So this is something very, very crucial they need to understand. Then there is a big role of vitamin C, big role of vitamin D3 and zinc. So these are the things which they can do it at home. So they must make sure that they take adequate supplements of vitamin D3, vitamin C, zinc, and adequate hydration means drinking enough fluid and water.
في الشباب الطبيب يقول ان العمليه الاصعب الايام الاولى هي الخمسة ايام الاولى، من اول ما يوم تنصاب بالحمى وراها لازم تبلش تراقب الاكسجين مالتك بالجسم، تاخذ الاسترويد، تاخذ مخففات دم، تاخذ فيتامين دي وفيتامين سي، وتشرب ميه هوايه، تشرب سوائل. جدا النقطه هاي مهمه. يس دكتور.
So I saw the video today where lots of patients who are from Iraq, they are stuck here and they were showing the unhappiness because they cannot go back. So at least if they cannot go back, they should stay indoors, stay in the hotel and not go out and mix with people, because you don't know who is infected. If you see every other person, he may not be having a symptom but may be infected. So I saw in the video there were lots of people, patients who were together to go back, showing the frustration and the anger. But that doesn't mean you should come out. Just stay away from the groups, parties, groups, stay away from interaction. Just stay isolated in the hotel. Nothing will happen. It's the only best way of prevention.
دكتور هيمنت يقول شفت الفيديو مال مناشدة العراقيين ومخوفهم وقلقهم. أنصح يعني التجمع هذا خطأ، لأنه يعرض حياتهم للخطر. ممكن يكون أي شخص بيناتهم أو شخص مار منك ويكون حامل للفيروس لكن ما عنده أعراض ويسبب يعني بانتشار الفيروس بيناتهم. لا يخافون، خلي يعزلون نفسهم، يبقون بالفنادق، يبتعدون عن التجمعات، يبتعدون عن أي مظاهر الحفلات أو كذا حتى يحمون نفسهم والمشكلة تنحل. يعني ماكو مشكلة تبقى بدون حل.
Somebody has again asked the question, which vaccine? Whichever you get it, that's what you need to take. Don't think you must take whatever you are getting it.
أي لقاح فهو لقاح فعال وشغال. لا تفكر إنه هذا اللقاح منشأه أو اسمه، مهم تأخذ اللقاح.
Because in the personal experience, which is not the experience to be quoted, I've seen people who have got 2 vaccines, they have got infected again, but their disease severity was very less. None of these people ended up into the ICUs on oxygens and ventilator. Disease passed away very easily. Those who had 2 vaccines.
أقول اللي أخذوا جرعتين، يعني يقول أنا كخبرة شخصية شفت المرضى اللي أخذوا اللقاح مرتين، يعني أخذوا جرعة كاملة من إصابتهم، حتى إذا ما صابهم الفيروس صابهم ما احتاجوا عناية مركزة، ما احتاجوا أكسجين، مجرد وقعة صحية بسيطة وعدوها، يعني صارت عندهم مناعة.
And one more message I want to give, that lots of patients are here waiting to have surgeries. I can talk about orthopedic patients, and I'm advising them again and again, please wait, don't have surgeries done. But still they feel that they just want to have surgeries. They don't understand if there is a complication at the time of surgery, their whole money will go waste, their health will be lost. So they should just wait and sit quietly. Things will improve. Our government is working very fast on getting all the things done. See, India is a big country. There's a huge population. So, but I'm very sure that the government is working to the best level to make sure that all the medicines and oxygen supplies are provided very soon, and things will improve very soon. But people from Iraq, they feel they are here, so they should get surgery anywhere. But they need to understand all the hospitals. If the big hospitals are struggling, then small hospitals will not have that much of facility. So that's something they need to understand. I would rather prefer to wait, because life is more important than anything else. You have come for
Yep.
orthopedic operations to improve the quality of life. But if the life is in danger, how can you think about the quality? So first, time to save yourself. Best way, stay indoors. Don't go out. You have got your RT-PCR at a hotel, you are at the airport, and also a new RT-PCR here. Make sure you are staying inside and not meeting enough people. Things will improve very soon.
دكتور هيمنت يقول احنا الناس اللي هي سافره من العراق واللي جايه لهنا الغايه منها انه هو يحسن من وضعه الصحي، يصرف الاموال سفر وتعب حتى يطول بعمره يحصل عنايه صحيه. احنا ليش هسه امتنعنا ان نسوي العمليات؟ لان نخاف على صحتهم. يعني ممكن ان تكون اي تعقيدات تصير، اي مشاكل اثناء العمليات مما تخليهم يفقدون حياتهم او يعني الامور ما تروح بالجانب الصح. نصيحتي لهم خلي يحافظون على انفسهم، يبقون بالفنادق. الحكومه الهنديه دا تشتغل بسرعه لحل هذه المشكله. عندنا مؤسسات عملاقه، يقول مؤسسات صحيه عملاقه ما تقدر تقاوم. كيف بون مؤسسات صغيره، مؤسسات خاصه بعض منها ايضا يعاني من هواي نقص، لكن اطمئنوا المساله تنحل بسرعه ان شاء الله. Yes, doctor.
Anything particular you or any of your patients would want to ask?
شباب اي احد عنده سؤال قبل لا ننهي البث ويا الدكتور خليه يكتب لي اياه، لان انا ما حقيقه ما جاني اي سؤال هسه. I still waiting. Any question? So it's, sir, as you said, do you think that situation is not going to be for long? Maybe within a week or 2 weeks maximum, it be solved.
I would say at least 4 weeks we should give.
4 weeks.
Because if you see in Gurgaon and Delhi, most of the population will get herd immunity within a month, because you hear everyone is having it or everyone has had it. So we will get herd immunity very soon.
Right. كل اتوقع انه بالزايد هي هاي الهجمه مجرد شهر واحد وننتصر عليها، يعني نتعداها. I think that's now is a time in Iraq people are going to break them fasting rosa time, so most of them they are busy of eating, so they're just watching. They don't write any question to us.
No, anytime if there are any questions, you can they can write it to you. I'll be more than happy to answer to the best of my knowledge.
Thanks you دكتور. الدكتور يقول اي سؤال في اي وقت، اي شخص عنده نقطة سؤال ممكن ان تسالونه، وممكن ان تدزوا لي وعن طريقي انا يعني ممكن اسال دكتور هيمنت. يقول اي معلومة انا اعرفها ما راح ادخل عليها لاي احد وان اشاركها وياكم. So thank you so much, Dr. Heyment. I would like that meeting is be repeating again and again whenever you get time, because this time is time of technology, and you know it's better to communicate with people through it than 15 minutes, 20 minutes, or half an hour. I would be happy if we repeat it with me or with others of any facilities who are working here in India.
Yeah, thank you, Dr. Ahmed.
Thank you, doctor. Have a nice day. Good
Thank
night.
you.
Good night.
شبابنا ماكو حد سأل، ما اضطريت انه انهي الحوار ويا الدكتور هيمنت. اتمنى انه استفاديتوا من عنده. طبعا اكو وصفة نستخدمها حاليا للناس اللي تزيد مناعتها، الماء مصابة، اللي يحتاجه ممكن ان يراسلني وادز لي اياه على الخاص اذا متوفرة بالعراق. ما اعرف هنا متوفرة لنا. هي عبارة عن فيتامينات سي ودي لرفع المناعة.